But yes, absolutely, you can use donor sperm, partner sperm. There are different ways to use donor sperm. Some individuals have a directed donor, somebody they know that wants to donate sperm to them. And there's a process that we go through to ensure that intended parentage is well delineated and that the sperm is healthy and a good match for an individual. There's also sperm banks where you can purchase sperm, and the process itself is essentially the same.
Roughly, I would recommend starting with 2 to 4 vials per intended pregnancy if you're starting with insemination. Most people who are pregnant with insemination will be pregnant within 2 to 4 IUIs. Occasionally, we get somebody who gets really lucky and gets pregnant with the first try and then has a lot of surplus sperm, but on average, you can expect 2 to 4. And so, the goal is if you want to have more kids down the line and you want them to be genetically related, you want them to have the same sperm source, then you want to have some surplus sperm available on hand to help you achieve that goal. We can, kind of as a last resort, if there's no more sperm available and you really want a genetically related sibling, then we can use sperm in very sort of limited amounts, and we can use that for IVF, in vitro fertilization. But IVF, obviously, a lot more technology, a lot more medications, a lot more expensive. So the goal for you is going to be to have enough sperm purchased so you have still a good chance of success with insemination in the future. And then kind of, have IVF as a backup option if we're getting to the last little bit of sperm, we can conserve sperm with IVF treatment. Right? So for insemination, yes, you would need to use a whole vial. The vials are designed to give you a good chance of success if they're used in their entirety. So all the vial needs to be used. And then for IVF, we can use just a portion of a vial. So it is possible to do that, but usually we have to use an advanced insemination strategy like ICSI, which is a little bit more expensive. So for IVF, we can conserve sperm and use just a portion of a vial, a fraction of a vial, but for IUI, we do need to use a whole vial.